Hello and welcome everyone to the BPHASA and the ARC Michigan PCP webinar series. Today is our waiver update and feedback session. Remember that you can use the Q&A function to submit your questions, and we will also be using the raise hand function today as well. If you're having difficulties typing or getting your question into the Q&A function, you can raise your hand. And I think Lindia will have some spots where she's pausing to answer questions. So if the webinar moderator does not answer your question today during the presentation, you may receive an email follow-up regarding your question. And I will turn it over. Let me change my share screen.
Thank you, Heather. Well, welcome. This is our fifth waiver 1915 HCBSD waiver feedback session. And Heather will be pulling up the slides. So we've had 6 total, including one presentation from the Self-Determination Conference and another presentation from the wraparound conference. So we'll have 8 total. So we appreciate you joining and appreciate the ARC for hosting. So we will just do some housekeeping items. I'll have Heather move to the next slide. And some introductions, and just go over the agenda. So again, introductions and housekeeping. We're also going to talk about, what's the purpose of, and what are our session objectives? What can you expect to learn from this webinar? What's the purpose of the webinar? And then we'll go over all of the 1915 HCBS waivers in Michigan. We will talk about the waiver renewal. So what does the renewal timelines look like? What is that process? What are those requirements? And then we provide an opportunity for feedback. We also provide important links. We have the feedback session schedule, which is just one that's left. And we also go over the feedback that's received. So seeing that you all are in our 7th session scheduled, or I'm sorry, that would actually be 9 or 7th session. We have received a considerable amount of feedback, so I think it'll be valuable for you to see what we've received thus far. And then finally, the conclusion. Next slide, please, Heather. So again, I'll introduce myself. My name is Lindia DeRomedy. I'm the manager of the Federal Compliance Section. So the Federal Compliance Section does oversee the 1915 CHSW waiver, and then the 2 children's waiver, the SED waiver and the children's waiver, that is overseen by our Children's Bureau. Next slide. So just a couple of housekeeping items. As Heather said, I will pause to take any questions throughout the presentation. We also have allocated time at the end for feedback. We also try and take that feedback as we're going through this process. Hold on, I may have a dog barking in a minute, so if I mute myself, that's why. And then we are also offering the Q&A function as a way to provide your feedback. You can also ask questions through that. But as Heather stated, if you have any difficulty in providing that feedback with that function, you can raise your hand and we will do our best to try and get to every person. Next slide. So this is just a kind of a basic overview of the waivers. So as I indicated, there are 3 waivers in the state of Michigan, 3 1915 HCBS waivers. The first waiver is the Habilitation Supports waiver, which you'll often hear people reference as the HSW, the Children's waiver, which people often reference as CWP, and the Serious Emotional Disturbance waiver, which you'll hear people reference as the SED waiver. So all 3 of our waivers expire on September 30th, 2023, and they are up for renewal. So waivers are approved for a total of 5 years. So we went through this process back in 2019, so kind of the before COVID timeframe, and our waivers were approved for 5 years. So those are up for renewal. So the purpose of really these sessions is to get feedback from Medicaid beneficiaries, their families, staff who work with staff who provide waiver services, providers, community partners, to get your feedback on the waivers and what we can do to improve the waivers. Are there any suggestions for services, changing the waivers, those type of things? And basically these sessions are going to help inform us of areas of need, areas where we can make improvements as we work on our waiver renewal. Next slide. So basically in some of these objectives, now again, if you are an expert in the 1915 HCBS waivers, you may not gain any knowledge or information about our current behavioral health waivers. But if you don't, hopefully this is providing a general overview of each of the waivers. It also provides you an opportunity for feedback and suggestions regarding our services, processes, requirements of these waivers. And then we also do go over what is the waiver renewal process? What are the requirements? What are the timelines that CMS has for us in this process? And I realize CMS, let me define that acronym very quickly. It's the Centers for Medicare and Medicaid. So going into the waivers, we will start there. And I believe the first waiver up is the habilitation supports waiver. So with this presentation, I do not go over all of the services. I kind of pause to let you all take a look at that and see what services are identified under the habilitation supports waiver. But I think the eligibility requirement is an important aspect to go over. And so really with the HSW, the person can be any age, but they must have an intellectual developmental disability. They must be living in the community. And so this is really important. Keep in mind, these are all, and again, I recognized I didn't define HCBS. So HCBS is home and community-based services. So meaning all of the services under these waivers have to be provided in the community. So again, you can't be in the hospital, can't be in an intermediate care facility or an institution for intellectual disabilities. We don't have those in the state of Michigan, but they are in other states. A nursing facility, a correctional facility, or a child caring institution. While someone is receiving HSW services, they must also have current Medicaid eligibility. And again, most importantly, they would otherwise require level of care services provided in an ICF or an IID, if not for the availability and provision of HSW services in the community. In addition, each HSW participant on the waiver, they must require and receive at least one HSW habilitative service per month. So our maximum waiver participant total in the state of Michigan is 7,902. And again, over to the right is the list of all of the habilitation supports waiver services. So we want to talk about that certification process for the HAB waiver. And basically the way that this is managed is that MDHHS assigns slots. We oversee the slots, but we assign them to each prepaid inpatient health plan. And they have an annual allocation of active enrollment. So they cannot exceed their active enrollment slot amount. And the other thing we do is we really look at who is our priority in terms of filling slots. So if you have a region that is utilizing all of their slots, they really need to be mindful of those those individuals that would meet this priority. And those individuals are children who are aging off the Children's Waiver Program, beneficiaries who are determined to be at high risk of intermediate care facilities for individuals with intellectual disabilities, and beneficiaries age 21 or older who need private duty nursing and meet the HAB waiver eligibility. And when one is applying for the habilitation supports waiver, the process is done through coordination between the CMHSP, the PIHP, and MDHHS. So the PIHP will work with the CMHSPs or their providers, and they will complete an enrollment packet. And they will submit that packet to CMS for review. And if the PIHP has an available slot, the enrollment request is initiated. What MDHHS will do is they'll review the request, the enrollment request packet, and based on the information provided, they will determine whether the person meets the criteria for the HAP waiver. Keep in mind at that stage, there can also be situations where MDHHS might request further information or request further documentation just to verify whether the person meets eligibility. We really try and do our best to ensure that we're not turning anybody away, that we're just overturning every stone. We're looking at everything just to make sure that, if the PIHP is sending us somebody who they believe is eligible for the HAB waiver, we are looking at everything to confirm that. And again, this information must support the need for a HSW service. And again, the PIHP must have an available slot, and MDHHS will enroll the person and issue an approval to the PIHP. We do have the capability, just on a side note, for we have slots that are allocated to the department to use for borrowing. So if a PIHP has, they are at their max slots, but they have an individual that meets this priority criteria that needs to be enrolled, they can borrow that slot from the department until a slot becomes available in their region. Again, enrolling is for 1 year. So after the 1 year period, there is a recertification process that's required. Again, the PIHP works with their CMHSPs and their providers to complete the recertification request packet and submit that to MDHHS. And then MDHHS will determine eligibility, and recertification occurs for 365 days. So what is the purpose of the habilitation supports waiver? A lot of people, there's some confusion about this, but we thought this was important to add. So essentially, it's really to provide that community-based support to people with intellectual and developmental disabilities who would otherwise require the level of care provided in an ICF. So again, we talked about that as being one of the requirements to meet eligibility for the HAB waiver. But really, the goal is for this waiver to enable people to, with significant needs, to live and fully participate in their community. So it's really that community-based aspect. Excuse me. Sorry, I might need to take a drink. But this is a great time to pause, because this is usually at each waiver. I take a minute to answer any questions, see if there's anything in the Q&A. I do see, I know Heather is, yep. All right. I think Heather wants to provide some information, and then we'll move forward.
Yeah, so I'm going to go ahead and launch a poll just to give us an idea of who our audience is today. So if you guys can just take a few minutes to fill in how you identify, either as a person receiving services, family, guardian, advocate, CMHSP staff, PIHP staff, or the provider staff, just to give us a general idea of our who our audience is today.
All right. Well, I do not see any questions in the Q&A. Let me just double check, and I do not see any hands raised. So if everybody is good, we will go ahead and move on to the children's waiver.
And I'm going to go ahead and end our poll.
Okay.
Maybe just give a couple seconds, and if anyone is still completing that. Looks like right now we have about 74% participation in that poll, so that is great. So I'll give just a second to see if anybody else wants to answer that poll.
And this information will be helpful for us because we want to really make sure that we're presenting this information and providing opportunities to everybody that is impacted by the waivers in the state of Michigan. So this information will be very valuable to us to ensure that we're meeting that benchmark. All right, well, I am gonna go forward with the children's waiver. So we'll start with the eligibility process. So again, they must meet the intellectual and developmental disability criteria. They have to be under the age of 18. They have to reside with birth or legally adoptive parents or a legal guardian. They also must be at risk of the ICF IDD, or they currently reside in ICF IDD, but could return home with appropriate support. They must meet Medicaid eligibility as a family of one. So this is an important aspect to the children's waiver, because in order for the child to qualify, it waives the parent's income. And on the children's waiver, these are typically individuals who would not qualify for Medicaid because of their parents' income. So this is what is very unique about the children's waiver. Intellectual or functional limitations indicate eligibility for health, habilitative, and active treatment services provided at the ICF IDD level of care. Excuse me. So you'll find that a lot of the requirements for the children's waiver is very similar, very similar to the HAP waiver, which makes sense because it's intended for those children who would not qualify for Medicaid. Children who do qualify for Medicaid would then be appropriate to be on the habilitation supports waiver if you look at all of the criteria for the children's waiver. So that's really the distinction between the two. Next slide, please. Okay, so again, the children's waiver, on the right side of the slide, you'll see all of the services provided under the children's waiver. And then over to the left side is really the overview of the children's waiver. So again, we talked a little bit about that. So it's for children under the age of 18. Again, if not for the provisions of the or if not for the availability and provision of the children's waiver services, they would otherwise qualify for the level of care and services provided in an intermediate care facility for individuals with intellectual disabilities. Again, the goal of the children's waiver is to enable children with developmental disabilities who have significant needs and who meet the criteria and requirements to live with their parents or legal guardians and fully participate in the communities. So I think what you're going to see with all of these waivers is that theme of being able to have an active and full life in the community with their families. And again, the objective is to provide regular Medicaid state plan services and waiver services that address the children and youth's needs. The maximum waiver participants for the state of Michigan is 569. And I think that's another thing that's important here is once the child qualifies for, they qualify and are approved for the children's waiver, they also get approved for Medicaid. And so that also allows them to utilize Medicaid state plan services. Next slide, please. So the children's waiver enrollment and annual certification. So and we've gotten a lot of feedback about this, about some of the struggles at the front door. And so we've appreciated that feedback and we're using it to look at making some changes and even enhancing some education that's provided out to our providers in the community. So I want to just say that before I get started with this, but, essentially, if there is a youth that's, is out, like is looking for services or believe as a prospective children's waiver enrollee, they would need to contact their community mental health service provider. So you'll hear me say CMHSP for those providers, and request access specifically for the children's waiver. So we know there's been some hiccups in that area that often if families don't request that specifically, they may not get it, especially when they're presenting with a third-party insurance provider. So we recognize that. Again, we're looking at that and seeing how we can address those issues and improve that process. I spoke about this before, about the children's waiver serving as a pathway to Medicaid, and that is a very important aspect to this waiver. So again, if if the CWP is requested and denied, in the potential enrollee, the child and their family must get a notice of denial, and they must receive their right to Medicaid fair hearing. And that's even if a lesser intensive service is offered. A pre-screen must be done here. And so this is a little bit different than the HAB waiver. And MDHHS will review and score the pre-screen, which really determines or reflects the level of need of covered services. The child will be placed on a weighing list based on the score. MDHHS issues invitations to enroll in the children's waiver every month. The waiver functions at full capacity, so a priority waiting list is utilized to enroll children in order of their highest need. So basically that means this is not a weighing list that goes in chronological order, but it goes in the order in which like the child with the highest needs will get priority. So if my child maybe was sort of in the, like, we'll just say like kind of in the middle of the scale, but Heather's child applies and it is a high priority, high needs, even though she applied for it 2 or 3 months after I did, when an opening comes up, she will get that priority. Her child will get that priority slot, not my child, just because of from that perspective. Recertification, recertification is submitted and reviewed annually to ensure continued eligibility. So much like the recertification process for the HAB waiver. Next slide, please. So what's the purpose of the children's waiver? Again, it's really just to be able to maximize the skill development for the child, really allow the child to remain in the community, maximize their skills, increase their capacity for future independence, and really looking at not only the child's life, but also looking at the family system and what is needed in order to meet the goals of the child. So again, that full participation in their community, and so that they can live their lives out in their natural home, whether that be with their biological parents, adoptive parents, or a guardian that is maybe another family member or another appointed guardian. So that is really the purpose of the children's waiver. And so we've moved to the children's waiver or the SED waiver, but I still don't see any questions or hands raised. So I'll pause for a minute just in case, let some of the information I provided absorb, and then we'll move on to the SED waiver. Okay, well, we're going to move on. So the SED waiver, again, this slide is very similar to the previous slides. On the right is all of the services for the SED waiver. On the left gives you a general overview of the SED waiver. So the SED waiver is different. There's a lot of similarities between the children's waiver, the HAB waiver, but the SED waiver is slightly different. So this waiver permits the state to provide an array of community-based services to enable a child who is otherwise would require our state psychiatric hospital for children. So that's the Hawthorne Center. So this allows them to remain in their home and community. The maximum waiver participants for this waiver is 969. So what does eligibility look like? So there's a residency aspect that is defined here. So they must reside with a birth or adoptive family and have a plan to return to their birth or adoptive family, or they must reside with a legal guardian or reside in a foster home with a permanency plan, or be the age 18 to 19 and live independently with supports. And they must be the age of 18 when approved for the waiver. So this is another unique aspect of the SED waiver, is that it goes to the age of 21. So if you recall, the children's waiver goes to the age of 18. This waiver goes to the age of 21. In addition to that, the person must meet MDHHS criteria for psychiatric hospitalization for children, or they are at risk of hospitalization without waiver services. And the individual must meet all three criteria: diagnosis, severity of illness, and intensity of services. They meet Medicaid eligibility for criteria or become a Medicaid beneficiary. So another unique aspect to this waiver is there is that waived income part, just like the children's waiver. So a child can either be Medicaid eligible, or they can go through the process to become eligible for Medicaid by waiving the parent's income. Next slide, please. Okay, so this talks a little bit about the eligibility. This eligibility is pretty specific for the SED waiver. So one of the requirements is that they demonstrate serious functional limitations that impair the ability to function in the community. So there's specific assessments that are completed for individuals on the SED waiver. So for ages 7 to 12 and 13 to 18, they have a CAFAS completed. And boy, and I wish I could remember what CAFAS stood for, and I see that it's not defined in here, so I need to update this. But for those ages 7 to 12, a CAFAS score is 90 or greater. For those ages 13 to 18, a CAFAS score is 120 or greater. For children ages 3 to 6, they use an elevated PCPHASA. So a PCPHASA assessment is used, but the elevated PCPHASA subscale scores in at least one of these areas. So self-harmful behaviors, mood, emotions, thinking, communicating, or behavior towards others. Or for those ages 2 to 4, they use the DECA, which is the Devereaux Early Childhood Assessment. And that has clinical version scales. And then it talks about the 2 scales that are used, the protective fear factor scales, and then the elevated scores on one or more of the behavioral concerns. So this is, again, very specific in terms of how serious functional limitations are measured and looked at in order to meet criteria for the SED waiver. Next slide. So what does enrollment and annual recertification look like? So again, at the front door, the SED waiver must contact the local CMHSP and request an assessment specific for the SED waiver. Again, the SED waiver serves as a pathway to Medicaid. Per CMS, this pathway must not be blocked. Whenever the SED waiver is specifically requested and subsequently denied, this is again where the person must be provided a notice of denial, and their right to Medicaid fair hearing must be provided. They must have a primary serious emotional disturbance qualifying diagnosis. They must also receive at least one SED waiver service other than wraparound service per month in order to maintain and retain eligibility. Eligibility is good for 1 year. It is renewed annually. And the SED waiver is really intended for 1 year with the possibility of a second year. We do know that there are individuals who are on the SED waiver longer than 2 years, but I think this is an important aspect to point out because most folks don't realize that. In addition to that, the intensity of services that are provided in lieu of hospitalization and out-of-home placement, so that that there is an intensive level of these services in the community in order to prevent hospitalization or out-of-home placement. And then the other aspect to that is that wraparound is mandatory. Next slide, please. So what is the purpose of the SED waiver? So it's not only to support progress towards improved overall functioning, but also to sustain the progress over time. So that is done by using the wraparound process, and that's going to help maintain high needs, maintain the high needs of the child, the youth, in the family home or in the community, wherever they are going to be most successful. And the goal serves the best interest of the child, family, and behavioral health agencies. So that's where that wraparound focus often comes in, is that team approach to the services. Okay, I am going to pause because I do see I have some questions in the Q&A. Tedra asked, can a child on a CWP slot be kicked off if another child with, no, they cannot be. Once you're approved for the children's waiver, as long as you maintain the eligibility for the children's waiver, you would not be removed just so a child with another, that maybe has higher needs is applying. Thank you, Kaylee, hopefully I'm saying your name right. She provided me the CAFAS acronym, what that stands for, and that's Children and Adolescent Functional Assessment Scale. Tedra asked, is there a set time limit a child cannot be on the SED waiver? No, there's not a set time limit. Again, redetermination and re-eligibility is done annually. So if there's any concern about a child not meeting criteria, then they would be transitioned. And again, those children who qualify for the SED waiver that have Medicaid, they would just transition to state plan services. Amanda Zimmerman asked, if a child is eligible for the SED waiver, are there criteria similar for the children's waiver? So that could be you. So Amanda, hopefully I'm understanding your question correctly. The eligibility for the SED waiver is different than the children's waiver. So that key focus is the serious emotional disturbance diagnosis. And then there's also, for the children's waiver, there's the IDD diagnosis. So often, that's really that first set of criteria that you need to, in order to kind of get you through the front door for those services. I don't know that I've ever had a situation or heard of a situation where people have transitioned from one waiver, like the SED waiver, to the children's waiver. I know we've had discussions about it in specific cases, but the major difference is that qualifying diagnosis. And then also the children's waiver has that habilitative requirement, and that needing that habilitative service need. The children's waiver is also sort of set up that this is sort of this is a lifetime diagnosis too. And so the definition of that can also, impact the difference between the two. So Tedra Jackson asked, what is the criteria for a child on the SED waiver being extended beyond 2 years? I have not known and again, Tedra, this is not my area of expertise with the SED waiver. I have not known anybody like after the 2 years to just be removed from the SED waiver. Again, they look at that the redetermination and re-eligibility every year. The idea though, honestly, Tedra, is that if the person is receiving those intensive services in the community, that they will improve, and then they would be able to move off the waiver because they don't require those intensive services. That's really the goal of the SED waiver. Thank you. Good questions. Okay, so I think, did I get them all? No, we did. Okay. Oh, apologies. I won't do that. All right. So next, HCBS waiver renewal timelines, processes, and requirements. So this is just a general overview. Next slide, please, Heather. Of what our renewal process looks like. And again, this is a very general overview. So in December 2022, we were required to complete a waiver quality report for CMS, and this was a summary of all of our 372 reports. Our 372 reports are our annual waiver report to CMS. And so the waiver report in 2022, that had a summary of 2020, 2021. We didn't have 2022 data for CMS at that time, which we ended up providing in July because we were still gathering that data. April 30th, 2023, CMS sent us their response to our waiver quality report. And basically the response was questions, asking for clarification, identifying concerns, all of those things. So, and this is all part of just how we're informing CMS, and CMS is monitoring our waiver performances. And so these reports are sort of that summary of that. So in between April and September, we provided some waiver renewal feedback sessions, and we're continuing to do that now. But at the end of July, we submitted our response to CMS. So currently CMS is reviewing that, and we do anticipate our final report from CMS at the end of this month. And basically what that will provide to us is that will provide to us CMS's recommendations for what changes we need to make with the waiver renewal. And that, I mean, that can be anywhere. I mean, they're going to really look at our performance measures. They're going to look at utilization of services. They're going to make recommendations. They are going to look at our sampling methodology, all of those things. And they're going to provide their recommendations. And those are recommendations we have to make. We can't just say, think CMS, that's a great recommendation, but we're not going to do it. Whatever recommendation CMS makes, we need to take into account for and make those changes in our next waiver. So with that said, that'll be the work that we're doing from this time to about, I'm going to say January, February. We will be working on our report. Our goal is really to have it completed probably sometime in March, because we need to be mindful of all of the other requirements like the public comment, internal review, all of those things. But CMS will send us a letter saying, hey, by the way, you've got your waiver renewal due to us. And then we need to send the application to CMS by 7/2/24. Ideally, we'll get a response from CMS before our waiver expiration date, but it is certainly possible that they could still be reviewing, and then they might extend our current waiver until that review is completed, especially if there's some back and forth between the state and CMS. Next slide. So again, I touched on this, I talked about the reporting that we have, our feedback sessions, the application changes, our application changes based on the feedback that we receive. We need to ensure that deadlines are met. We need to ensure we fit in that 30-day public comment. We need to ensure that we have an internal review and approval that goes on. So all of that needs to be done before we submit to CMS for final approval. Next slide. I don't see any further questions. All right, so we'll move to the opportunity for feedback. And this is generally just to give you all some ideas of, what you can think about for feedback. So this is related to like the services, the waiver services, and those services provided through all three waivers. So are there services that are not currently being provided that should be? Are there services that are underutilized and are not really beneficial to have in the waiver? How can current waiver services be improved? Are there services provided in one waiver that should be provided in another? And can the provider requirements for certain services be changed? So these are just some things, some ideas, some thoughts to trigger feedback from you all in terms of what considerations can we make with our waiver renewal. Next question, or next slide. So this has to do, so if you're thinking about the process, the waiver process, so this is related to eligibility, enrollment, recertification. Is there any way that we can improve the process for enrollment and recertifications? Are there any suggestions to create efficiencies with the waiver processes? Any changes to the eligibility process, those requirements? Next slide. An opportunity for feedback, last one, is The requirements related to documentation, performance measures, enrollment, recertification, oversight, staffing, training, etc., all of those things are there considerations we can make to reduce the paperwork requirements, reduce staff qualifications and training, create efficiencies, and are there some requirements we have in place that aren't necessary at a federal level? And some other things, we utilize the waiver. We utilize the WSA. It's the waiver support application. Is there anything with the waiver support application? And just, how can we improve quality of services? Should we increase the number of individuals on each of the waivers? Are there restrictive policy language that we need to look at or change or clarify? We've gotten a lot of feedback about clarification on current policy language related to the waivers. Okay, so again, here are the links to all of the waiver applications. I joked around earlier this summer that if you needed some summer reading, these were good applications to review. I am going to provide the ARC provides a copy of this presentation to attendees, but I will also, once we have our final waiver feedback session, which is on September 27th, I will send out the completed PowerPoint. And the reason I'm doing this is because we're adding all of the feedback that we received to this PowerPoint. And that way, if someone attended an earlier session, the PowerPoint they would get would look much differently than someone who attended one of these later sessions. So I wanted to provide that clarifying language. Next slide. Okay, and so I mentioned our last and final session is next Wednesday, September the 27th. It is from 10 to 11:30 a.m. Next slide. Okay, I'm going to pause because I do see some questions. We received I think this is feedback, paid parent guardians for CLS hours since there's a staffing shortage. That is actually a feedback that we've received. So you'll see it in future slides. Where can we send our feedback? At the end of this presentation, I will provide my email address. You are welcome to provide any feedback to me, or if you know your leads for each of the waivers, you can send them any feedback you have as well. Respite, DHS should pay respite providers for non-face-to-face time. Respite providers are so hard to get and keep. Part of this is because they are thrown into a demanding job with little training and support. If SED waiver is the key and respite is medically necessary service, we should have respite provider on the wraparound team to maintain. Okay, so this is feedback in terms of respite providers and respite services. Appreciate that. Thank you. Okay, I think we've answered the questions. So this next session is really just I'm going to zip through all of the feedback we've received. So many of you will see some of the feedback that you've already mentioned, and some you may go, oh, that's a great idea. I'm so glad that someone mentioned that. So for the HAB waiver, we have received several feedback sessions, the addition of specialty services to the HAB waiver. So that's music therapy, recreation therapy, massage therapy. People are seeking clarification regarding PDN and habilitative services for goods and services. And this is another one we've received lots of feedback on, to include an approach to improve health and wellness and remove the must replace human service requirement. Consider the addition of adaptive clothing to medical equipment and supplies, equine therapy, and that's been across all three waivers. Consider moving IDD services out of the mental health code into long-term care. I'm not sure that we can do that, but that was one of the feedback we received. We have received feedback regarding several codes. One is regarding the T2047 under the HAB waiver. I think to make that a 15-minute code versus an hourly code. It would be great if the HSW could cover more needed equipment, needed by individuals with severe medical needs. Next slide. Adding TEFRA as a covered population under the HSW. This goes to some of the code modifications to pre-vocational, make that a 15-minute code and bring back the H0043 per diem code. Add more slots for some regions, allow guardians or responsible relatives to be paid caregivers. This is again across all three waivers, and we've received that feedback in this session. Remove licensed residential bed limits. So for the HAB waiver, that is any person on the HAB waiver must be residing in a licensed specialized residential setting that is 12 or under. We're getting feedback on both ends. We're actually getting feedback to remove that limitation, and then we're getting one to reduce that. So instead of 12, go down even further for those on the HAB waiver. Also count ABA services as a habilitative services for HSW up to the age of 21. So again, this is another one that is across all waivers that they're asking that ABA services be added as a waiver service so that it can be counted as a habilitative service. Next slide, please. So more feedback, increase the time between recertification requirements. People are asking, can we make that every 2 years? Unfortunately, we can't, because that is a CMS requirement and that can't be changed. Reduce the required documentation for the HAB waiver, decrease the layers for approval. So this would require a system change, and many of these are also across all three waivers. We're seeing this as recommendations across all three waivers. Make the consent due at the same time as the recertification. So for the HAB waiver, the consent is due every 3 years. The recertification is annually. So this request is asking that the consent be done annually as opposed to every 3 years. Make the WSA easier to use. That's across all three waivers. More users for the WSA across all three waivers. These two things here are things we can take into consideration. Now it doesn't have to be a part of the waiver renewal. We can see how we can improve that process. Be more transparent with audit requirements. Another thing we can look at doing now as opposed to being part of the waiver renewal. Add personal care services to the waivers. So this would eliminate the need to apply for home help. Provide clarifying language of overnight health and safety. This is a request across all three waivers. And then expand enhanced pharmacy. All right, I'm going to take a pause because I see I have some questions. And so I'm going to take a pause just to make sure I can answer them. Would it be possible to reduce the HSW eligibility certification form? Yes, this was also, what this person is asking, can you reduce it down from a legal size paper to an 8x5? We are looking into that. And we will see what we can do about that. So I think it was discussed, the next feedback, I think it was discussed in the last feedback session, but it would be very helpful if we could get the questions from the slides with some contact information to respond to. In the feedback sessions, we go over those questions quickly, so it's difficult to provide. Yes, so regarding this, I'm tracking all of this information. We're taking it in. We are answering it, and my plan is to share it with everybody who's participated in these sessions. So as long as your email address and your contact information is included with all of these, we will make sure that that's done. Just give us a little bit of time. Seeing the last session is next Wednesday. We'll need some time to make sure that we have been gathering them all. We've been answering them as we get them, but I just want to make sure we go through them, have them completed, and then we'll share them. So the next question, can home help be incorporated into the waivers? Yes, that was actually, well, I'm going to say, yes, we've received that feedback, and yes, we are looking into it. That is that one feedback about personal care. So it would be like, currently we have personal care in residential settings in our state plan. So we would be looking at adding personal care into the waivers. So for individual who lives in their own home and needs a live-in provider, the only way overnight supervision can be paid is if the provider stays awake, which is not acceptable. You're welcome. Sorry, someone said thank you for looking into something. This would require another individual coming in home for the night and the night shift. This is disruptive. Yes, we are clarifying this language. We think there's a lot of confusion out there. So I think with the work that we're doing now, we're looking at providing clarification for that. Again, overnight health and safety is very specific in the way that it's defined. And so I think what is causing some of the confusion is that people are thinking overnight is just overnight health and safety. If you have somebody helping overnight, that's what that is, but it's technically not. If the person needs assistance, so it really just depends on what interventions or what's happening with that person and what their needs are, whether you can call it overnight health and safety or if it's technically CLS. So we're going to provide some clarification on that. Good feedback and good question. I think I'm good to move forward. All right. Okay, so we're gonna go to the children's waiver and look at, oh, I'm sorry, we're on the SED waiver. My apologies. I forgot the HAB waiver. We had a lot of feedback from that. So we've had some feedback about parent support partners, look at time limits on units, clarify the 16 hours of training required, remove wraparound as a requirement of the SED waiver. So this speaks to something I just was talking about, the overnight health and safety. Change the language on OHSS and replace it with something else to cover overnight. Yeah, we're looking into that. I think that's this has been great feedback to get. Add phone number as a required field in the WSA. People are waiting too long for services. So I talked about this at the beginning, improve that access process. This is also for the children's waiver. Can music, art, rec therapists provide services while working toward their board certification? Next slide. Add language about independent living to include licensed independent living program. Current language is not clear about the requirements for independent living. Modified language that says SED waiver is intended for 1 year, but with the possibility of a second year. It would be helpful to clarify this, that SED waiver is intended to be short. Create more information regarding waivers so that it can be shared, like pamphlets. And this is another one that's across all 3 waivers. Add language clarifying. Oh, I have add language clarifying language to clarify. I need to fix that. Resident requirements to specify birth means biological mother, father, and add birth family with current parental rights intact. Excuse me. Add more options for telehealth services, and that one also is across all 3 waivers. Okay, so for the feedback we've received for the children's waiver, request more slots, reevaluate lifetime eligibility, change language on overnight health and safety. This is something else to cover overnight behaviors that are non-medical. The application process for the CWP takes too long. For one person, it took a year. So there's a couple of things with that. How do we improve our application process, but also address why it is taking so long? Across all waivers, so this one we've heard quite a bit, case managers need to be better trained on the waivers and waiver services. This causes delays with families and individuals applying for waivers. Clear guidelines on home modifications and other durable medical equipment type items that are available through the CWP. For credentialing, change the 1 year of DD experience or allowing a supports coordinator without a year of experience to be supervised by a QIDP. It can be challenging at times to find staff. So this is actually already in place. If a person does not have the 1 year of DD experience, but they have the education experience, as long as they're supervised by a QIDP, they are able to work with a child. The person who's the QIDP just has to sign off on everything and supervise, provide that supervision and provide evidence of supervision. Fencing service could be clarified. So this is in the Medicaid provider manual language to include additional considerations, including but not limited to behavior treatment, committee reviews, etc. And I think that is the last feedback. So I think we got a question about you know, this goes by pretty fast, and you're, you know, if you're like me, when you're in these webinars, you're trying to take in all the information, you miss something, or you think about questions like tomorrow. That's okay. I have provided my email address here, and you know, feel free to email me. I may not have the answers for you, but I will work with my coworkers and our specialists to get the answer that we need. And again, if this is more of a specific, you know, situation occurring with an individual or someone you serve, it is helpful to send an email, because then we can address that on a case by case aspect. I think, oh, I've got 2 questions now. So please consider reducing the amount of audit prep that is duplicative or unnecessary, e.g. chart reviews. This is a significant burden on the CMHSP disruptive. I completely understand that. I'm not sure that that's possible. I'll be completely honest. I'm not really sure what CMS is going to say. They really sort of identify our performance. Well, we identify our performance measures, but we have to meet assurances. So depending on what the assurances are, ideally for the person who wrote that question, if you have any suggestions, or if you can provide more specific information, I would love to hear back. Because, you know, now that we have the 1915 ISPA, that is part of our audit, and part of the site review, you know, where the amount of individuals that and cases that we're looking at has increased significantly. So if there is a opportunity for us to save administrative burden on you know, the CMHSP, PIHP, and my staff, I'm more than happy to hear what your suggestions are. So please, love for you to email me. Next question: can you add specific requirements for self-directed services into the waiver requirements to align? We are looking into that. Good feedback. Definitely take that in. We will add that, but we are looking into how those things apply to specific areas of our waiver and our waiver services, and how that applies. There is already language in our waiver applications about self-directed services and what is required from the budgeting perspective, all of those other things. So we are taking a look at that language and just making sure that it is accurate and it is thorough and provides the level of information we need. When is the deadline for feedback to be considered? So good question. We are looking at, in terms of our timeline, we've already started our waiver renewal process. We've already started working on this. You know, I think we could feasibly probably try and take feedback up until the end of October. Just keep in mind that, you know, it's sort of a work in progress. So when we have recommendations like add a service or reduce a service, those things have budgeting implications. And part of our requirements to CMS is that these services in the community that we're providing to individuals in the community are effective, keep the individuals out in the community, but are also not as do not reach the level of what institutional level of care would cost. So those are things we need to be mindful of when we're looking at considerations for our waiver renewal.
And we do have a hand up, so I'm going to go ahead and allow Laura to ask her question.
I think that was an accident on mine. I think I thought I took the lower hand on there, but I did just have one thing. Wanted to try to double check and verify. You said 4 HSW individuals in specialized, currently 12 bed homes are acceptable?
Up to 12, yes. So individuals on the HAB waiver can live in a setting that is, I believe the way licensing has identified as 12 beds and under. But if an individual lives in a bed that's 13 and over, they cannot be on the habilitation supports waiver. I don't know if that answered your question.
Okay, and we do have another hand up, so I'm going to go ahead and allow Amanda.
Hey, can you hear me okay?
Yes.
Okay. Did you say that wraparound is required for the SED waiver?
Yes, it is.
Okay. All right. I too think that requirement should be removed. Would you like me to send detailed feedback via email? Is that best?
Yes, if you'd like, because I think one of the considerations is not making a requirement, but also looking at could we offer wraparound services like as a service array for all children.
Yeah, I think that'd be good. Ours is a little bit confusing. It seems like they don't really take ownership of the case, so then our home-based therapist ends up doing a lot of the paperwork, and it takes away therapy time from our little one. So that piece has always been a bit confusing to me.
Yep, and I think what that would be super helpful to to even address, like, talk about what are what are some of the roadblocks that you're seeing with that, because perhaps if we have something written in our waiver that sort of creates that roadblock or creates the process that's causing some of these problems, we want to fix that.
Okay, yeah, I find it to, then I have to find childcare to make the wraparound meetings happen, and it adds a lot. These kids are already in an intensive program. They're on this for a reason, and it just seems like nothing gets accomplished. And then when there's a ton of follow-up emails, and it just seems like a waste of an hour.
Yeah.
So
yep.
I'll
No,
send
we've we've definitely heard that feedback, and it is appreciated. And we want to make sure, because you're right, that this is a group of children, or children who require that intensive needs service, and wraparound is it's a great program. It really is, but it's intensive, and how do you do that on top of everything else?
Okay, thank you.
Thank you. Well, I know we're right at 4 o'clock. Oh, there we go. Got a question. All right.
All right, go ahead, Kim.
Hi, Lindia. I was you said you're not sending this out until all of the sessions are completed. Is that
Yes.
correct? Okay.
Yes.
I had just thought of a couple things while you were going through this, and now I can't remember them already. So that's why I was just wondering, but that's fine.
Yeah. Yeah. And so again, if you want to add any, you know how to get a hold of us, Kim, if you want to send any more feedback, or just like you said, if you thought of something and then you remember it tomorrow, send that our way. We'll be more than happy to take a look at that and add that to the feedback.
Thanks.
And Kim, I will be sending out the PDF just from today's presentation by the end of the week.
Yeah.
Perfect. Thank you.
So if anything new is added from this presentation, and we've had some new feedback, which is good, that won't be included on this PowerPoint, but I will add it to the one that's we're having next week. And then whatever is provided next week will be added to that final PowerPoint. I'm going to try and email that out to everybody who's attended. As long as I have their email addresses, I'll get that out to everyone. So we received a feedback. Can you add more detail to the audit protocols? Sometimes we don't know exactly how reviewers want the documentation. And if we did it, would have saved time doing corrective action plans. Yeah, and that is not necessarily so much a waiver, anything we need to change in the waiver. I think we would just probably need to provide more technical assistance at the beginning so that our providers are aware of that. Inform parents of independent facilitators at the local level. Gosh, I would hope that that's being done, but we will add that to our feedback. Appreciate that. Heather, do we have any more hands raised?
I'm not seeing any other hands up.
Okay. Well, I appreciate everybody's participation. I appreciate the feedback we've received. Oh, we're getting questions. I'm gonna. So the question we received is I can't even talk today. What is an independent facilitator? An independent facilitator is a person who is essentially hired by or brought in by an individual served in their families to facilitate the individual's person-centered plan or plan of service. So there is some training requirements that is required for that. Independent facilitation, individuals can ask for independent facilitators to facilitate their plans of service anytime. I'm just going to pause for a minute. Every time I say you were good to go, then we get a question. So I'm going to just pause for 1 minute. And if we don't get any more questions, again, you do have the opportunity. Don't like if you're like me and you think of something, you know, an hour after this meeting or tomorrow, you can email me, no problem. We have been taking questions and feedback this entire time, and we will continue to do so.
And just a reminder to everyone that you will receive an email from Zoom with a copy or with a link to the recording from today's video. And then I will also send out the PDF of the presentation.
All right, we just got clarification of goods and services. Yep, and that's added and that's on our list. So thank you again for providing that feedback.
All right, if that is all the questions that we have, we are a little bit over our time. We're at 4:07. So we can go ahead and end today's session, and the email address is up there. If anyone has any further questions, please feel free to email. Thank you all for your time today and for all of your feedback.
Yes, thank you. Appreciate your feedback and attending.